Welcome, CyberMDs, to another cardiology lecture for the USMLE Step 1 exam. Today's lecture will delve into two important cardiac conditions that are major contributors to morbidity and mortality worldwide: sudden cardiac death and chronic ischemic heart disease. Before we get started, please remember to like, comment, and/or subscribe if you find the content here useful in any way so that we can continue to provide free medical education resources for students around the world. Additionally, please tell your friends about our content and let us know if you think that we can improve the lectures in any way at all. Let's get started. Sudden cardiac death is defined as unexpected death from a cardiac cause that occurs within 1 hour from the onset of symptoms. It's usually, but not always, due to some sort of ventricular arrhythmia. Most commonly, this arrhythmia is going to be secondary to some form of an acute ischemic injury to the myocardium, and we know that many patients with heart attacks have a pre-existing atherosclerotic process, so remember your risk factors. Other causes include contusio cordis, which is when the heart structure itself is damaged in some way, and this causes the heart to undergo cardiac arrest. Typically, this is traumatic in etiology, such as a motor vehicle collision. It can be caused by a rupture of the myocardium itself or a heart valve disruption, and it's typically, again, with regards to the underlying etiology, traumatic in nature. So think about blunt force trauma. Another cause of sudden cardiac death that recently gained attention due to the NFL's Buffalo Bills player Damar Hamlin is called commotio cordis. In this condition, a blunt trauma to the anterior chest wall causes a disruption in the heart's electrical activity, sending the patient into VFib and subsequent cardiac arrest. The impact must occur specifically during the upsloping of the T wave, and the window is only about 20 to 40 milliseconds wide. Because this is secondary to chest wall trauma, it's often seen in young male athletes who are participating in a contact sport. All of that said, the most common cause of sudden cardiac death, again, is coronary artery disease or ischemic heart disease. It occurs more often as individuals age, and other causes include significant structural changes to the heart muscle, such as hypertrophic or dilated cardiomyopathy. It includes myocarditis or other genetic disorders that affect the heart's electrical system, such as a Brugada syndrome or long QT syndrome. Risk factors for sudden cardiac death include, again, and I can't stress this enough, a history of coronary artery disease, previous myocardial infarctions, heart failure, significant valvular disease, genetic disorders, as we've mentioned, certain lifestyle factors such as smoking, alcohol consumption, illicit drug use, specifically cocaine. Prevention of sudden cardiac death includes appropriate treatment of known risk factors, particularly that coronary artery disease. This often involves lifestyle modifications, pharmacotherapy for conditions such as hypertension or hyperlipidemia, and potentially coronary revascularization in certain individuals. Treatment in the event of sudden cardiac death involves immediate cardiopulmonary resuscitation, i.e. CPR, and defibrillation, followed by post-resuscitation care that includes identifying and treating the underlying cause of the cardiac arrest. Chronic ischemic heart disease is a condition in which reduced blood flow to the heart muscle over an extended period of time, i.e. chronic, often due to the accumulation of plaque in the coronary arteries, that coronary artery disease, results in heart muscle that is chronically underperfused and may become ischemic. This small amount of ischemia can slowly cause damage, which may inevitably lead to or cause patients to develop congestive heart failure, also known as CHF. The image here on the screen is microscopy of interstitial fibrosis that is secondary to chronic ischemic heart disease. The main cause of chronic ischemic heart disease is atherosclerosis. Risk factors for atherosclerosis and consequently chronic ischemic heart disease include age, male gender, family history of heart disease, smoking, hypertension, diabetes, high cholesterol, obesity, sedentary lifestyle, and poor diet. Now, symptoms of chronic ischemic heart disease typically include angina, which is chest pain, shortness of breath, fatigue, and sometimes syncope. Diagnosis of chronic ischemic heart disease involves history and physical examination, as well as an EKG, maybe exercise stress testing, and possibly even imaging studies such as coronary angiography. You can also get biomarkers such as troponin and a BNP, that's B-type natriuretic peptide. These can also be helpful in making diagnosis of chronic ischemic heart disease. Management of chronic ischemic heart disease involves addressing the underlying atherosclerosis, that's first and foremost, then relieving symptoms and preventing complications such as MI or sudden cardiac death. Lifestyle modifications and medications such as statins, aspirin, beta blockers, ACE inhibitors are going to be the mainstays of treatment. In some cases, coronary revascularization procedures like angioplasty or CABG, which is coronary artery bypass grafting, may be required. In conclusion, sudden cardiac death and chronic ischemic heart disease are two important cardiovascular conditions with significant implications for global health. Both have shared risk factors and underlying pathologies, and often the prevention and treatment strategies for one condition can positively impact the other. Thanks for tuning in, and please remember to like, comment, and/or subscribe so that we can continue to provide free medical education resources to students around the world. If you find our videos useful at all, please be sure to let a friend know, and remember that you can catch all of our lectures for free on Spotify. See you next time.